MetaPhy can best be described as a chronic disease management company. We want to provide a comprehensive care management approach to patients within the GI space.
We really started the company in the beginning of 2017, and initially we were a diagnostic company focused in GI, but we uncovered considerable chronic disease in the GI space. And so recognizing that problem was how we determined to try to find a tool that would allow us to deal with these patients.
We started working with ThoroughCare in 2017. We wanted a strategic partnership with a technology vendor who could help us grow and help us scale. And ThoroughCare really checked two boxes for us, and that was they were big enough to do the things that we wanted them to do, but they were small enough to care about our input and really value that input. And so it's really been a great partnership.
When we first started with ThoroughCare, we had a couple hundred patients. We're now over 24,000 patients. We really are focused today in CCM and RPM with ThoroughCare, and then heavily utilize their analytics platform. ThoroughCare really helps us on a couple of different fronts. From one standpoint, they have the clinical expertise that we really need to get in front of our patients and provide them with the answers and the directions of how to live their life. ThoroughCare really helps improve that and really makes us a much more efficient company. Then on top of that, they also provide us with the tracking mechanism to make sure that we know how many times we've reached out to our patients. How much time have we spent with them? Are they meeting the goals that we have set for them? Are they overcoming barriers that we have identified with them? All that is within the ThoroughCare platform.
So we use ThoroughCare every day to treat our patients. It's an essential part of our process and workflows. It really helps us manage the patients to ensure they get those monthly phone calls, but also as a clinical resource to provide that clinical value and outcome that we are focused on with our patients. The benefit of using ThoroughCare for our clinical documentations rather than multiple EMR systems across physician practices is the consistency of the documentation. Being able to track and monitor the patient's medication reconciliation, care coordination, and clinical outcomes from one central source is a huge benefit for us. We are so passionate about our patients. We're so passionate about this space that we're in right now. So we're treating patients with 3 or more chronic conditions. And so it's very important for us that the patient understand their conditions. It's very important that they understand how to make healthy decisions from a medical perspective, but then also from a mental and a social perspective as well. They look forward to those visits. They look forward to those calls with our associates to better treat their overall health.
ThoroughCare is really helpful for us as clinicians to get down into those details of the patient assessment, where the prompts and questionnaires that you go through the enrollment process that really make even suggestions for those patients' specific conditions, I think sets that apart. Each of our care managers on the follow-up side manage 265 patients. And so the care managers from day to day, they use ThoroughCare as a tool to identify the patients that they need to contact, to document their health assessments and update their care plans, to create billing encounters. Specific patient engagement metrics that are important that we want to track and monitor, definitely completed calls, engaged patients that take our calls each month. RPM usage of their scale each day is something that we're going to be looking for, and ThoroughCare allows us to see both of those things.
ThoroughCare is one of the key components in our implementation process to make sure that the sites are set up correctly and that our staff is trained appropriately so that everybody knows how to manage those patients, and ThoroughCare really makes it easy to do that. It has a very easy to use dashboard that allows us to view those numbers in real time and really manage and monitor those programs. Since we've incorporated analytics into our monthly KPIs that we provide to the physicians, that's really been helpful. We're able to track things like enrollment data and opt-out data, reasons that patients opt out.
Analytics within ThoroughCare has really revolutionized the way that we're able to use the system. We utilize ThoroughCare on an enterprise perspective. So we have 50 different practices all within ThoroughCare, and we utilize the analytics to be able to bring all of that information together, to be able to look at it in a holistic view. We analyze those on a monthly, weekly, and daily basis to determine, are we giving the most optimal care to our patients? Are we meeting our goals with our patients and with our company? And how we should move forward in our decision making. It really needs to be based on the outcome of the patients and how we can overcome barriers. And in order to do that, it's truly doing it in a value-based system. And as we utilize the ThoroughCare platform, it allows us to track these patients. It allows us to report on that. And it really allows us to look at that patient's life cycle within our system to determine, how did we get them there? How can we utilize that same type of approach for our other patients?
Using data and analytics is really key and mission critical to our success. We have a saying around here that we want less dogma and more data. And so we like to take the data that we have from all of our systems, turn that data into information, and then use that information to manage the business in real time. We've built a platform that really provides what I would say is clinical, operational, and financial value to a GI. Clinically, it's sound for their patients. Operationally, it's non-disruptive to their practice. And financially, it's a good revenue source for them in a time when most GIs are looking for income repair. And ThoroughCare's been with us every step of the way.